Long COVID will probably ultimately be noted to be a diagnosis that is an umbrella diagnosis. Because as we're doing more and more research, we're discovering that different people have not only different symptoms, but probably different pathophysiologies of disease. I first started treating patients in 2021, right after the start of the pandemic, when we started seeing patients who had these persistent symptoms that weren't going away. And I think at that time, we really thought that long COVID was going to be this primarily what we call respiratory issue. But as the pandemic has progressed, we really started to see that long COVID itself is evolving, and that for some of our patients, their long COVID symptoms are evolving, even if they haven't had COVID again. And so now with the Omicron variant, that's really been the predominant COVID variant of the last year at least, we have really been seeing this evolution of long COVID into being more related to these combination of neurologic symptoms as well as cardiac symptoms. So we've really seen an uptick of what we call dysautonomia, which is just really where patients are having kind of irregular neurologic signaling to their heart, which is leading to abnormally fast heart rhythms and drops in their blood pressure, sometimes increases in their blood pressure. We really weren't seeing that with the initial variants of COVID. Currently, it exists as a diagnosis of exclusion, meaning we exclude other medical conditions before we can say a patient has long COVID. And this presents a unique challenge because we don't have any diagnostic tests that we can say, hey, you definitively have long COVID. It really requires a long and extensive and rather expensive testing process to come to that conclusion. Secondarily, there's no FDA approved treatments either. Although, on this trend at least, there has been a lot of research done on other post viral conditions. And so we're using the knowledge that's already been out there in treating patients who may have had a post mono syndrome or a post flu syndrome to really help them manage their symptoms better. And really, a lot of our knowledge around treating long COVID has come from research that was done previously in treating patients with myalgic encephalitis and chronic fatigue syndrome, also known as ME/CFS. But it is taking a combination of medications depending on our patient's symptoms to help get them to have symptom relief. Two of these medications that have made quite a bit of fur in the long COVID community have been low dose naltrexone, which naltrexone at high doses is a medication we've used for opiate use disorder, and then low dose aripiprazole, which is also known as Abilify, which is a antipsychotic medication. But at low doses for both of these, there has been some relief in fatigue. Brain fog has been a little more tough to manage, and we've had to use a combination of neuromodulatory medications. So these can include your antidepressants, your anti anxiety medications. We've seen a degree of promise in using some of our medications that we've used in treating dementia, as well as ADHD. So, some of the stimulant based medications have really helped our patients with focus and memory as well. I think my biggest concern at the moment is that until 2021, long COVID was not even recognized as a potential syndrome. And we are just starting to get the funding sources to be able to start focusing on creating those tests to identify who has long COVID and find those treatment plans for patients as well. And in our current regulatory environment, it looks like we are potentially facing an uphill challenge of trying to get more funding to help support these patients. I've seen a lot of challenges with health insurance and getting these treatments covered for our patients because they're not FDA approved, and insurance companies understandably are very hesitant about providing those treatments to their patients if they seem untested. Furthermore, we're having a lot of challenges now also as patients are nearing their 2+ year mark of having long COVID of the disability system. And we are going to have to also face the uphill challenge of trying to get these patients to get long term disability, especially in a system that can be very hard to negotiate. And when they already are dealing with symptoms like brain fog and fatigue that affect their ability to function in day to day life.